Heart disease is the leading cause of death worldwide. While traditional treatments manage symptoms, they don't repair the heart. Cardiac regeneration offers new hope by aiming to repair damaged heart tissue using innovative methods. Cardiovascular diseases affect the heart and blood vessels, leading to serious conditions like coronary artery disease and heart failure. A damaged heart struggles to pump blood efficiently. So what is the challenge? Heart muscle cells don't regenerate easily. But breakthroughs like gene editing and stem cell therapy are changing the game. CRISPR-Cas9 gene editing can precisely correct mutations that cause heart disease, such as hypertrophic cardiomyopathy. Stem cell therapy uses induced pluripotent stem cells to become heart cells, potentially restoring function in damaged areas. Early trials show promising results. In tissue engineering, scientists create lab-grown heart tissues using scaffolds that support cell growth to aid healing. Bioartificial hearts, made with a patient's own cells, may one day replace transplants and reduce rejection risks. Though still experimental, they hold major promise. Challenges remain, from immune reactions to ethical concerns about gene editing. But researchers are working to make these therapies safer and more effective. As cardiac regeneration advances, there's growing hope for millions. Like and subscribe for the latest updates in heart health.